Keeping a symptom diary for ulcerative colitis is extremely important because it gives your physician some insight into how your disease has been behaving for the weeks or months preceding your visit. So instead of just the sort of snapshot in time of right when you come into the office and the few days before, we can really get a sense of how you've been doing over time. You can keep a symptom diary in any format that you want, as long as you do it consistently and systematically. For some people, that means writing in a physical notebook. Other people, it could be writing in a calendar space on a day-by-day basis. Some people, it's just taking notes in your phone. It really doesn't matter how you do it, as long as you do it with regularity. First and foremost, we want to know about your bowel habits. How often are you having bowel movements? Also, are you waking from sleep to have them? Are your stools diarrhea, and are they always diarrhea, or are they sometimes formed? Are you having bleeding with your stools? And if so, how often is that happening? Are you ever having episodes that are just mucus and blood without stool? And then are you having things like urgency or accidents, or a feeling called tenesmus, which is when you sort of feel like you have to poop in your rectum but nothing is coming out? We also want to know how your symptoms change when you eat certain foods. And that's not because foods themselves actually trigger flares, they don't. But certain foods can make you feel worse. And so it's important for us to identify which foods trigger you to have symptoms, because then we can actually help you change your diet to feel better. Additionally, we would want to know the sort of outside of the GI tract symptoms, which would include things like joint pain or swelling, or redness in your eyes, or rashes and skin changes. And then lastly, we would want to know symptoms that are sort of more general, like fevers, chills, sweats, weight loss. And additionally, fatigue. Fatigue is a really important manifestation of inflammatory bowel disease, so it's important for you to keep track of that when it occurs and to what severity. If you keep a symptom diary, we'll really understand how you're feeling on a day-to-day, hour-to-hour basis. It means that you need to keep a record of how you're feeling at different points, and that helps us to identify what's making you feel sick, which gives us a better sense of how to treat you. Sometimes those patterns are hard to pick up if you're not feeling well on a day-to-day basis, but if you're actually keeping track in a systematic way, we can really identify those things and make a difference in how we're caring for you.